Hi, my name is Mauro Zappaterra, and I'm the medical director here at Synovation Medical Group of our multidisciplinary treatment programs for chronic pain. Today I have an individual with us who is joining us to discuss his experience of what it's like to go through our functional restoration program. Thank you very much for joining us today.
You're welcome.
I was just curious, you participated in our functional restoration program. How did you get to the functional restoration program?
Okay, well, my doctor, just briefly, I had an accident at work. I had to go through workman's comp, and through a series of them sending me to different orthopedic doctors and stuff, I ended up with Dr. Seltzer here at Synovation, and it was Dr. Seltzer that actually recommended the program to me. And so I did, and I can't wait to talk about it.
So what was your experience of the program?
Well, let me begin by saying that when I came to the program, I was, physically and mentally in the same. It was really, the pain was unbelievable. I was able to, like I said, once I started the program, I never thought for a minute that it would be a miracle thing. But I was hoping that they would get me at least in the right direction as far as exercising and different ways of just everyday kind of stretching and floor exercises to help me kind of get on that road to wellness. And now it's been not quite a year, and during the program and subsequent since I've left, I'm still doing those same exercises they showed me how to do. I have to tell you, I feel a lot better today than I did a year ago.
And so in your own words, could you describe the program for other people who are interested in the program? What was the program for you?
Well, that's exactly, pleasure to talk about it. In the beginning, I thought there was so much to it. I think once I got to let me say, there's a team of people that you're going to come and see. It's not one person; it's a team of people. Psychologist, where you can kind of let yourself air your frustrations, air your grievances as far as your mental attitude towards the whole thing. And once you get to that, then your physical therapists are the ones that take you, and they talk to you, ask you where the pains are. In my situation, I had a curved spine, I had bulging discs, and a lot of spasms and stuff, muscle spasms. So what I was able to do is that when I first got here, after I told them my situation, they were very careful on how they let me exercise and let me, like I said, a lot of isometric, a lot of stretching, almost yoga-like, I guess you could say. It's not yoga, but it's yoga-like with the kind of things they had me do. And I have to tell you, every day, by the second week, I could already still feeling my muscles kind of coming back a little bit. That's it. I could feel the effects of it right away. So now it's been about 4 to 6 months later, and I think it's been about 4 months since I finished the program, and I'm continuing with all those exercises that they had me do, and I'm feeling better. It just seems like every week I feel a lot better. I mean, I'm not where I was before I got hurt at work, but I'm getting there, and I think you just have to have a stick-to-it-ive attitude. You have to want to do this. I mean, it's not easy. It's painful. I expected all of that. I wasn't disappointed with the pain at all, but that I knew that experiencing that, I knew I was on the way to getting better and getting well. So,
could you describe your typical day before the program and now, what your typical day looks like now after going through the program, and what you felt like how the program may have benefited you?
Great. Yes. Before I did all this, it was really bad. The pain was so bad that I wasn't able to lift. I wasn't able to push or pull. Really, I was really restricted on my physical ability and on my what I was able to do physically. The pain was so bad that I'm not one to just lay in bed all day. I mean, I don't care how much the pain is. I'm one to just get up and go and it was painful almost every single day. I had my good days, but they were very few and far between. When I got to the program, and subsequently after the program, I have to admit that I still have I have a bad day occasionally, but it's not anything like it was before I started the program here. And again, I want to reiterate, the people here will show you what to do, how to do it, and the rest is really up to you. I mean, the people here are wonderful. You sit down and talk with them, and they're not going to do anything to hurt you. They're here to help you, and that's all I expected, and that's what I got. I can honestly say that I feel better now than I did prior to coming to this program. So, hope I'm saying it right.
Great. No. One of the components of the program is obviously how the pain is affecting you psychologically. Could you discuss how you benefited from the psychologists and the mindfulness meditations that you've learned and things like that?
I sure can. In the beginning, of course, the only thing they gave me, this is after the accident, and when I first started with workman's comp, in most cases what they do is they mask the pain, so that I got plenty of pain medication. That wasn't a problem, but it wasn't fixing anything. And until I finally decided to myself, I thought, well, the pain medication's okay, but it's not helping me get well. As opposed to coming in here and there was one of the doctors is a psychologist, and what she taught us how to do in the program was to breathe, take deep breaths, use eucalyptus oil and different kinds of peppermint kind of oil that you would put in your hand, and you breathe in like this, you take big deep breaths, and you're amazing how your lungs just feel so much better. You feel like you can take in a lot more air. It's pretty amazing. I mean, something as simple as just breathing right. The pain, at that point, the pain was so bad that prior to coming here, I wanted to say that I really thought I talked myself into maybe never getting well again. Then I thought, well, no, sure, if you don't want to, then you won't. So coming here, wanting to come here, and doing all this after all of the, like I said, the psychologists teaching me how to breathe and teaching me how to just start your day off with it. Start before you exercise, just taking big deep breaths and get yourself. It's amazing how the amount of energy you can get just from breathing right. And then all the physical therapists with all the different kind of floor exercises they were having me do. Nothing. I mean, it hurt. I'm not going to lie. But it wasn't. But it was worth it. I mean, and now so many weeks later or so many months later, I'm just really glad I did this, because now I'm doing this kind of exercise every day, and I think it's really helping. And it's I would recommend this to anybody, especially you seniors out there, especially you senior Americans like me. Like I said, workman's comp is a nightmare. It is what it is. No different than disability. But once you get off of it and I used my Medicare, I used my secondary insurance for this program, and I had to pay very little. I mean under $100. I would do that every time. And if it cost me less than $100 for this program, I'd do it. Because of all the expertise of all the people here, what I liked about it is they really want to help you. I could feel that. It wasn't like it's just a routine kind of thing, just go from one person to the other, do this exercise, do that exercise. They really kind of interact with you to make you feel like, well, yeah, you can do this. And it's really I consider it a blessing, really. I mean, and like I said, I started with workman's comp, never thinking I'd ever get to this point, because workman's comp got you here, got you there. You get too friendly with a doctor, they want to switch your doctors and stuff. And like I said, it just happened. I got lucky with the one I got here at Synovation, and he was the one that recommended the program. So it started out as a bad thing, but it ended up pretty good considering I was able to go through this program. So
wonderful.
Yeah.
Do you have any final comments for anyone?
Well, I just again, I don't want to be repetitive, but I can't say it enough. If this is something that you have to want to do, is there going to be pain involved? Yes, there is. Like I said, after 5 years of basically not moving at all, because everything I did was painful, I just got to the point where I said, well, I'm not going to do this. I can't do this. You can't live on opioids all your life. You can't. It doesn't fix anything. It just doesn't. So I wanted to fix the situation, and I would recommend this program to young and old. But since I'm a senior American, I'd highly recommend it for the seniors. Don't be afraid of it. A little pain is not going to hurt you, and if it does, If you do have any pain, your therapist they'll work around that so you can do it with very little pain at all. But don't expect it to be pain-free. It's not. And I'm not going to lie. There was some discomfort, but like I said, almost 6 months later, I'm feeling better now than I have in 5 years. So I don't know how else to say it except don't be afraid. Want to do this. Don't do it because you have to or because, oh, well, I guess Medicare will pay for it. No, that's not. It's really about attitude. It's your attitude towards it is what's going to make the difference.